Hello everyone, my name is Shubham. Today I am representing my team Infinite Lupus as a team lead, and we are very pleased to present you all to our project for Sunstone's Hackathon I.0. This is Sanjeevani AI. This is a rural healthcare AI bot that we are aiming to create to help the people of rural India who are not very much aware or have literacy knowledge about the medical healthcare sector or centers. This is still a prototype. So as we walk through the prototype, I will explain you about how we are aiming to counter the challenges and what is our future vision with this project. This is our prototype. It is hosted on GitHub pages. This is the basic UI UX for currently. This is almost also is the current startup page. But talking about the future, we are aiming to create a registration phase in which the user could enter their name, their medical condition, if they are currently having any medical problem, like if they are diagnosed with sugar, high pressure or anything, or they can also give inputs about the region they belong to. When the AI will be integrated, it will analyze all these points and will give a more specific personalized solution which will be more beneficial for them. Talking about the UX will be mostly the same. We want the website to be very easy and simple for the users of the rural India, as they are not very much tech oriented or have experience to use this kind of websites. So we want this to be very basic and very simple to use. Talking about the features, the first feature that I found very important is the language selection feature. As we already talked, this website is mostly for the rural Indian citizens who are who are not very much comfortable in Hindi and English. They mostly prefer their regional language, or more specifically their mother tongue. So how it will work out is that if, for example, I input that my region is in Assam, Guwahati, so I will have the options of English, Hindi, and Assamese. I can select the Assamese, and all the language will be automatically transferred into the Assamese language. Currently, there are only three options, but in the future version or the future updates for the websites, there will be some other options having named as other, in which I can select any language over India. It could be Marathi, even if I have entered my region as Assam. It could be Kannada, Telugu, anything. Talking about the second feature, it is the emergency call feature. What is that is why we have made it is that sometimes the user is not in a condition to write a chatbot or watch a video, book a consultation. All he need is some very immediate medical support. So this feature will help them to connect with the closest or the nearest ambulance services. So this feature is for case of any serious emergency or some serious medical attention. Talking about the second feature is the AI chatbot feature. Currently, there are only some basic remedies of some very common illnesses that we face in our daily life. For example, if I type F FEVER fever, enter, you can see that it give remedies in some very common ways. Rest in a cool place, drink plenty of fluid like water and water, as we all know this stuff. But after the AI will be integrated, or like or I should say in the final version of this website, if I enter fever, it will ask me of how many days I have them, how am I feeling about them. Did my places have mosquitoes, did my pollution in my cities is high or not. And analyzing all those factors, it will give me a basic simple um, simple solution for that, and if the analysis came to any conclusion that the user should have some medical assistance, it will directly uh, suggest me to go to the doctor. For example, if I write stomach, STOMACH, stomach pain, as you can see, first it gave me some simple remedy steps. So this will be the steps if the AI analyze come to a conclusion that the problem is not very serious, it can be easily be compromised with the home remedies. But if the analysis come to a conclusion that this can be some serious problem, it will give me the warning that if the pain is severe, seek medical help immediately. It will ask me a bunch of questions also for every problem. Like if I ask for stomach pain, it will be ask me for how many days I'm having it, the food I am eating, again the quality of the water, air I am having, and etc. etc. The next feature is the first aid emergency guidance. So this is mostly will be some video animation video type of toolkit or resources toolkit that will give me some basic steps that I could should do if some any kind of problem happens. For example, if I go to the minor injuries, currently it is only giving me some basic sentences of some immediate steps that I should do. But in the final version of the website, what it will do is that it will provide me with some videos, some live videos with some actual full steps written on it in many languages. For like if I select Hindi uh, and the minor injury section, the video will be also be in Hindi and the steps will also be in Hindi. So that's how we are aiming to grip first aid kit section. There will be much more symptoms, much more thing. Second section will be the book consultation section. User have to give their name, their phone number, and any brief description of the symptom, like I am I am I am having serious pain in my head. I have given my name, my number. I have given a brief description of my symptoms. I submit request and a pop-up will come. So what will it will do is that it will book their appointment with some nearest hospitals, so which will have some of the best reviews in the Google, and will automatically book appointment for them uh, for the required doctors according to their problem. The second and the last feature would be to the find hospital feature. What it will do is that at first it will ask me to enter uh, my destination or the current place I am in. For example, if I say I am in Dibrugarh, Dibru, or for example if I say I am in Kamrup district, I go for search, it will give me a list of some hospitals, some of the top hospitals in the Kamrup district, and I could call them. I could directly contact them. It will give me a directly call option, or it will also give me a phone number of that hospitals, or I can also see the directions of these hospitals, and I can we are also aiming to create a book cab options there also, in which the taxi services or the travel services will arrive to take us to the respected hospital that we are willing to go in. And the next is the FAQ sections. This is mostly for the people that will visit the website. It is for some of the basic question that can came into their mind. which LLM model are available in this platform. You can get the answers here. The last section will have the links. Currently there are some social media links, but at the end there will be links to contact with our team, some government helpline numbers, and etc etc. So this is our prototype for the rural healthcare AI bot. It is still in a very static phase, but with as our future vision, we are aiming to deploy it with the help of the government, and with collaboration with some of the top or if not top, with some local medical healthcare centers or hospitals, which can help users to get more frequent and fast services. That's all. I hope you like I hope you can understand our future vision. Thank you.